Hello everyone and welcome to the Fertility Method webinar week. We're super excited to have you here, and very shortly I'm going to be talking about female fertility tests. But first of all, I just wanted to start with a little introduction. So I'm Rachel and I'm a fertility acupuncturist, and I had my own fertility journey. My son was born after 3 rounds of IVF. So from my own journey, I became really passionate about helping others going through fertility issues. So my clinic's very much multifaceted, so we look at all areas, not just acupuncture. I then started the Fertility Method, which is an online platform, and this is suitable for women either struggling to conceive naturally or women that are going through IVF. We offer different levels of support, from our basic self-guided online plan, where you work through the modules yourself, to our bespoke plan, where I work with you one-to-one over a 3-month period to really help get to the bottom of what might be going on with your fertility. So if you think that any of this resonates with you, or you think you might want to work with us, then you can book a free 15-minute call via the link on our website. I'll link it on this page. It's also in our Instagram bio as well. So, female fertility tests, what a minefield this is, hey? It's important to say that clinics won't just test all of the tests that we're going to talk about as standard. So when you go into a fertility clinic, you are effectively going to be sold IVF. It's not always in their interest to try and get to the bottom of your fertility issues. So you might have to ask, or just push, be your own advocate, push a little bit for some of these tests. There is also one test that doesn't exist, I wish it did, and that is the test for egg quality. So IVF can give you some idea as to the quality of your eggs. However, there is no single egg quality test. So let's start with the basics, and we're going to run through in order of how conception happens, because that makes sense. So the number one thing to check is, are you ovulating? So if you're not ovulating, then you won't get pregnant naturally. It's completely possible to not ovulate a mature egg each month and still have a period or a bleed. And in fact, this is something that I really often see in clinic. So there are a few ways that you can check to see whether you're ovulating, basically, such as temperature charting. You can use OPK sticks. However, neither of these are fail-safe, and they shouldn't be sort of relied on solely. The best way to check you're ovulating is to either have an ultrasound around mid-cycle, or the luteal phase of your cycle, so the second part of your cycle, or to check whether a corpus luteum exists. So this is the empty sac that the egg leaves behind. And on ultrasound, that's viewable, so you can see that empty sac, so it's normally a sign that you've ovulated. Or to get your progesterone levels checked around 6 or 7 days after you think you've ovulated. The corpus luteum releases progesterone once an egg has been ovulated. So low progesterone levels are common in women that have not ovulated, because that corpus luteum is not releasing the progesterone. So if you've had a progesterone blood test and it's come back under 30, then it might be that you're not ovulating, and it should be investigated further. I've seen so many women who have tried for months and months to get pregnant, and they're 100% certain they're ovulating, who then, after having an ultrasound and getting their progesterone checked, are shocked to realise that they're not ovulating. So the next part of the process is to make sure that fertilisation can occur. So we're going to talk about sperm quality on Friday. But one thing that's key to check, and it's not a test per se, but it's whether you get the egg white cervical mucus each month. And this actually helps the sperm to enter the cervix and enables it actually to reach the egg. So you can check this yourself at home. It's the slippery egg white stretchy type. And so if you were to do this with your fingers, it would stretch and join both your fingers. It feels slippery when you wipe. If you're not getting any of that egg white cervical mucus, then it's possible that we need to look at your hormone balance, as the mucus comes from the changes in hormone levels around ovulation. But we will come to hormones shortly. Next up, is the egg able to travel down the fallopian tube? So if you know you're ovulating, you've had a sperm analysis completed, and you're still not getting pregnant, and this would be a good sort of next point of call to get checked. So you wouldn't know if your tubes were blocked necessarily, as it often presents with no symptoms. So something called a high COSI, it's often known as, is a procedure performed to flush out your fallopian tubes, and they use a sugar solution and a catheter. and then at the same time the doctor will use an ultrasound on your lower abdomen so they can see what they're doing. And sometimes this procedure can also improve your fertility for the few months afterwards as well, so it's always worth considering. Definitely had a few patients in the clinic that has been a success for. So if fertilisation occurs and the embryos travel down the fallopian tube, then we need to make sure that the uterine environment is conducive for implantation. So this means that the uterus is free from any infection, any inflammation, and that there's nothing physically stopping implantation from occurring. So your immune system will also play a part in implantation, but we're going to discuss that shortly. So these procedures are not sort of commonly tested, and you might have to push for them. However, something called a hysteroscopy, which is a camera that goes inside your uterus and looks for things like fibroids or polyps or anything that can be missed on an ultrasound, or a surgical procedure called a laparoscopy. And this is something that's used to look for and diagnose and remove any endometriosis, which is important to say can present with no symptoms. So if you know you're ovulating, your sperm health is tip-top and your tubes are clear and you're still not conceiving, then this would be sort of the next place to go. I would say that asymptomatic endometriosis, so endometriosis with no symptoms, is actually a lot more common than you think. And in my clinical practice, I have had many women whose fertility issues fell down to undiagnosed endometriosis. And this has an impact on your fertility because it affects the progesterone receptors within the womb and also egg quality as well. Now, underpinning all of the things that we've talked about is your hormone balance. So are your estrogen levels optimal for fertility? Is your thyroid behaving? Are your male hormones within check? These things will all affect egg quality. And since we can't check egg quality, we should at the very least be checking the hormones behind it. Of course, egg quality also relates to oxidative stress levels from lifestyle choices. But if your hormones are not balanced, then it could be having a bigger impact than you realise. For example, let's talk about androgens, so male hormones. So high levels of androgens are the single biggest factor that can hinder your fertility. And you don't always have lots of symptoms of this. You might have, slightly more body hair, for example, but you might just think that's normal because you've always had that. At the very least, I would recommend getting the following tested. So your follicle stimulating hormone, often known as FSH, your luteinizing hormone or LH, your estrogen, and it's the E2 variety we want to check, your prolactin, your thyroid stimulating hormone, also known as TSH, your testosterone, and finally something called your sex hormone binding globulin or SHBG. You can ask your GP to do this for you, or you can use a finger prick testing service such as Medichecks and then get the results interpreted by a specialist. Now, often clinics will not check any of this. So if you're having IVF, it's likely they'll check your follicle stimulating hormone and something called your AMH, which we'll discuss in a minute. But they will want to know how well you'll respond to the drugs. But the other hormones, it's just not in their interest to check. So they can affect your egg quality. For example, if you've got low testosterone, it's possible that you then have low DHEA levels and poor egg quality, and supplementing with DHEA could make a big difference to your egg quality. So even if you're having fertility treatment, it's still worth getting this basic hormone profile completed. Let's have a little chat about something called AMH. So this stands for anti-Müllerian hormone, and it's tested by fertility clinics as it gives them an idea of how you will respond to the stimulating drugs in an IVF cycle. So it can also be used to signpost diagnostically. For example, if you have something called polycystic ovaries, or you might have a higher AMH, or if you have endometriosis on your ovaries, you might have a lower AMH. There's so many misconceptions around AMH, and it's often discussed as being a measure of your egg reserve, when in fact evidence shows that it's only really an effective measure of egg reserve when it's used alongside something called an antral follicle count. And this is a scan where they count your follicles in any given cycle. So AMH on its own, it's really not a measure of your egg quality, egg count rather, and it's sort of fairly irrelevant in natural fertility as long as all the other components of conception are working, i.e. you're ovulating, the sperm health is good, your fallopian tubes are clear, then a low AMH shouldn't really hinder your chances. If it is low, you might want to get your DHEA levels checked, as low AMH can often mean endometriosis on your ovaries, and DHEA can really help with egg quality that's compromised by endometriosis. So, vitamins and minerals, something else that really should be checked. There's a few key ones for fertility. So I'd recommend as a basic getting your vitamin D checked, your folate and your B vitamins, and your iron levels. So vitamin D needs to be much higher than the normal reference range to be optimal for fertility. And iron deficiency can also contribute to poor thyroid function. So if your thyroid stimulating hormone returns sort of questionable or borderline, it would be worth getting these vitamins and minerals checked. Quite often in clinic, well, I'm actually yet to see anyone in clinic that returns an optimal vitamin B test for fertility. Should be around 120, and very often it sits sort of around the 50 mark. So there are also some more complex tests that you can get done, and these tend to come into play after you've had repeated unsuccessful IVF or recurrent loss. And these could include things such as a thrombophilia profile, which checks whether your blood is clotting too quickly and too much, and this can hinder blood flow to the uterus and the placenta. Something called natural killer cells and immune issues. So these can hugely affect implantation and recurrent loss. There's something called an ERA, which is an endometrial receptivity assay, which checks the optimal time that your uterus is receptive for implantation, and then embryos can be transferred at that time. The treatment cycle is more tailored. There's also some tests that check for inflammation and infection. They're called Emma and Alice tests. Again, they're not the most standard of tests, but if your clinical history points towards that being a potential, then it's worth getting done before you embark on any fertility treatment. So sadly, many of the more complex tests they're not completed until after recurrent losses or unsuccessful IVF. However, if you want to know more about these, you can listen to me talk about them in much more detail. For example, you can head over to our Instagram bio, where I've linked a webinar that's all about NK cells and immune issues. Some of you might find that quite interesting. I do hope that you have found this helpful. You can pop any questions that you have in the comments and we'll do our very best to answer them. Or you can book your free 15-minute discovery call using the link that I'll pop below, also in our Instagram bio. And then we can have a little chat about whether you think we might be able to help you, how we can work together. So when you work with us on a bespoke plan, we'd go through your case history in detail and we'd provide you with a follow-up that's effectively a plan to work out what's going on and what might need any further investigation. We pop it all in order of priority. So we recommend where to go, who to see, and then we support you through that process with follow-up calls. It takes around 3 months. We always like to work with people for 3 months because that's how long realistically it takes to have an impact as a minimum. We hope that in that time you'd get to the bottom of what might be going on and whether you're ready to start IVF with an optimal chance of success or to continue trying naturally. And along with that, you get access to our online platform with all of our nutritional, coaching and exercise programs that are all there designed to help support your fertility. So I will see you on Wednesday, where I will be talking all about unexplained infertility. Thanks for listening.